As a surgeon, the most successful patients are those that come with something broken and we fix it, or a bad arthritis that doesn't allow them to sleep at night, and now they're able to participate in life. So I started my career in mechanical engineering. I have an undergraduate degree in mechanical engineering. I always liked fixing and building things, and I thought someday I'd move to Detroit and be an automotive engineer. Sometime during my college years, I learned about orthopedics, and it's very mechanical. And in my early career in medical school, I did research in biomechanics, used my engineering degree to help me figure out problems to improve orthopedic care. For me, the most rewarding part of what I do is seeing a patient improve. They come to me with a problem, and I can fix that. I can recall many patients who, the day of their hip replacement, they immediately feel relief from that achy groin pain, and they're able to walk. And those are the most grateful patients. My name is Klein. I'm a general orthopedic surgeon with Henry Ford Health, and I'm passionate about improving my patients' function and pain relief.